Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them snappily. This video is part of our series explaining bacterial infections. Today, we're talking about non-enteric gram-negative rods. Quick questions before we start. Which microbe smells like grapes and infects burn wounds? Which curved rod is linked to ulcers and gastric cancer? Hang tight for the answers. Non-enteric gram-negative rods are a diverse group of bacteria that don't live in the intestines, but still cause serious disease. Some thrive in water, others in mucus, and a few are microaerophilic. Let's break them down. First is Pseudomonas aeruginosa. The strict aerobe is oxidase positive and produces a blue-green pigment called pyocyanin. Its colonies often smell like grapes. Pseudomonas is non-lactose fermenting, motile, and survives in moist places like sinks, humidifiers, and contact lens solution. It's a common opportunistic pathogen, especially in hospitalized or immunocompromised patients. Pseudomonas is known for burn wound infections, ventilator-associated pneumonia, UTIs, and bacteremia in neutropenic patients. It also causes chronic lung infections in patients with cystic fibrosis, forming biofilms that let them resist antibiotics. Treatment often includes piperacillin tazobactam, ciprofloxacin, or aminoglycosides, usually in combination due to resistance. Next is Legionella pneumophila. This fastidious, oxidase-positive, non-fermenting rod grows on buffered charcoal yeast extract agar with iron and cysteine. It stains poorly with gram stain. Silver stain helps with its detection. Legionella lives in aquatic systems like air conditioners, hot tubs, and water tanks. It spreads through aerosolized contaminated water, not person to person. This microbe causes Legionnaire's disease and Pontiac fever. Legionnaire's disease presents as a gradual onset atypical pneumonia with high fever, dry cough, watery diarrhea, vomiting, and confusion, often leading to hospitalization. Pontiac fever is a self-limited flu-like illness without pneumonia that resolves in a few days without treatment. A urinary antigen test helps with Legionella diagnosis. Treatment includes azithromycin or fluoroquinolones. Next is Vibrio cholerae. This comma-shaped, oxidase-positive bacterium thrives in salt water and spreads via contaminated water or seafood. It ferments sucrose and forms yellow colonies on thiosulfate citrate bile salts sucrose agar. Vibrio cholerae produces cholera toxin, which activates the GS protein and increases cyclic adenosine monophosphate, leading to chloride and water secretion into the gut. Abrupt, profuse, watery diarrhea, known as rice water stools, arises, producing severe dehydration and electrolyte loss. The main treatment is aggressive rehydration. Doxycycline can shorten the illness. Next is Aeromonas. These oxidase-positive, facultative anaerobes live in freshwater and brackish water. Infections follow aquatic wounds, leeches, or ingestion of contaminated food or water. Aeromonas causes gastroenteritis, cellulitis, or even necrotizing fasciitis. These microbes resist penicillins but are usually sensitive to fluoroquinolones, cotrimoxazole, and third-gen cephalosporins. Next is Helicobacter pylori. H. pylori is a curved, motile, microaerophilic rod that's urease positive. The urea it produces allows it to neutralize stomach acid. H. pylori colonizes the gastric mucosa, causing chronic gastritis, peptic ulcers, and risks for gastric cancer and mucosa-associated lymphoid tissue lymphoma. For diagnosis, the urea breath test checks for the gas produced when H. pylori breaks down urea. The stool antigen test detects bacterial fragments in feces samples. A biopsy spots the bacteria in stomach tissue. Treatment includes a proton pump inhibitor with clarithromycin and amoxicillin or metronidazole. Bismuth is often added to improve bacterial clearance and protect the stomach lining. Next is Campylobacter jejuni, a curved, oxidase-positive, motile rod that likes low oxygen and grows best at 42 degrees Celsius. It's often acquired from undercooked poultry, unpasteurized milk, or contaminated water. It causes fever, bloody diarrhea. and right lower quadrant pain resembling appendicitis. One complication is Guillain-Barré syndrome, where the immune system attacks nerve cells after infection. Severe cases lead to ascending flaccid paralysis, where weakness starts in the legs and moves upward. Respiratory failure stems from paralysis of the breathing muscles. Most Campylobacter infections resolve on their own, but severe or persistent disease may require azithromycin. Now let's review. Which microbe smells like grapes and infects burn wounds? Answer: Pseudomonas aeruginosa. Which curved rod is linked to ulcers and gastric cancer? Answer: Helicobacter pylori. Got them both? Sublime! If this video helped you, hit like, share, and subscribe. Tap the link below to download the table comparing these microbes. Thanks for watching.